Hi, my name is Joanne and I'm back here in Singapore for a holiday. Before, when I was in Australia, I did a teleconsult with Dr. Mark at Halley Medical Aesthetics to get some Botox and fillers done. So here I am today for the treatment.
Hey Joanne, hi. I'm Dr. Mark. Nice to meet you. Okay, so maybe to get to know you a bit better, have you done any aesthetic treatments in the past before?
Yeah, I've been to see Dr. Terence Tan at Halley
Okay.
quite a few times. So
Right.
I've had fillers done before and Botox as well.
Okay, all right. So how do you find those treatments? When was the last time you did it? So how do you...
I think it was quite long ago. I think maybe it was about a year plus or more ago.
Okay.
And I did like the effects of it, and that's why I'm back to see if it can be done again.
Looking at your face in the mirror, which parts concern you?
I think under my eye, I think it's volume loss due to age, old already. So yeah, it's a little bit like I don't know how to describe it, but it feels a little bit sunken in under my eye. And I think because my my cheeks here are quite large, so I think there's a little bit of like sagginess here as well. I'm not sure if there's anything that you can do about it. I think it's just here, the eye trout, and then like here, and in terms of like just the face shape here, is it possible, like I don't know if there's any treatment that you could do to make it more like like I feel like the muscles here are a little bit big.
Okay, all right. And also you're concerned about overall sagging, is that right?
Yes.
We can definitely consider fillers for your under eyes, the tear trough area, the mid face. So volume loss in that area can give us quite deep shadows, right? And it can also make your eyes look quite tired. So replacing the volume helps quite a lot of my patients. So for your sagging over your cheeks, there's a little bit of sagging along your jawline as well. Well, we can definitely fill along the laugh lines, make it less obvious. You can't make them completely disappear, and they always reappear when you smile. So that's essential. If they are permanently gone even when you smile, then it's definitely not natural. So while we can do that, I also like to do fillers along the cheekbones. So there are strong ligaments here that when we put fillers underneath the ligaments, they help to lift up the face. It gives you a mild and natural looking lift for the cheeks as well as for the jawline area. So that's something that I really want to explore with you as well. For your muscles down here, so you seem like you know a bit about it also. So there's a muscle of chewing. There's a chewing muscle here called the masseter. So it can make our faces look a little large sometimes. So what we do for that is we inject the muscle with Botox. The Botox is to get the muscles to relax, and then the muscles grow smaller with time. Yeah. Okay.
Yeah.
So I think those are the things that we can explore for you. So just going a little bit into the procedure and any potential side effects. So fillers, the fillers are all quite biocompatible. What we use routinely is the HA fillers. Okay, so HA is a carbohydrate protein molecule, and it integrates very nicely with the skin. It doesn't cause any skin allergy or skin reactions. Okay, and then it ages naturally with the face. So the lifespan of the filler for HA fillers is at least about a year or so. So you can expect to have the results lasting for at least a year, sometimes up to 2 years. You can feel some lumps or bumps under the skin, but they should not be visible. Okay, so it takes a few weeks for the filler to integrate into the tissue. So you will feel some bumps under the skin for a few weeks. There's a risk of bruising, of course, because we're doing injections, but honestly, the risk is quite low. And then finally, there's a very rare chance of vascular accidents, meaning that the gel, the filler, can actually run into blood vessels, can block the blood supply to the skin of the eye, and it can cause serious injury. So that's definitely a potential hazard. But fortunately, it's not so common. So we try to avoid and minimize that risk by using a cannula, by avoiding different, dangerous areas, yeah, to reduce the risk of vessel injury lah. Okay, so that's about fillers. For Botox, essentially it's just an injection. So you might feel some soreness because there's some volume injected into your muscle, so it feels a bit, you get some muscle soreness. And there's a risk of bruising also. But apart from that, not much issue. You might have some weakness in chewing, but as long as you're not like constantly chewing gum or eating like bakwa, like really tough stuff, it's not a problem.
How long will it last, like the Botox here?
Okay, so Botox, the lifespan of Botox is classically about 3 to 4 months. So after 3 to 4 months, the effect wears off, your muscles start to move again. So as your muscles start to move, they start to grow slowly. Yeah, so I guess practically your question might be, how long does the slimming effect last? The slimming effect is not immediate also, so it takes 1 month before you start to see the slimming results. I think usually about, it also depends on how many times you've done Botox in the past, but it usually starts to grow back after about 6 months. Yeah.
Usually I take photos, right? I always like show this area because you can see like, it's less lying here. I look a little bit more plump when I take photos with this angle versus this angle.
Okay.
So I don't know, is there anything that you would recommend for this area?
As I mentioned before, fillers, when we put under the cheekbone ligaments, they can give a bit of a mild lift, so that can be helpful. Other lifting procedures that I think are quite suitable for you, probably like our therapy, so using ultrasound to stimulate collagen, so that tightens the area. Okay, but before considering all those options, I also need to assure you that it's quite normal to have an asymmetrical face. It's mild asymmetry lah. Okay, and very often I realize that my patients, they have one side that's slimmer, one side a bit chubbier. Maybe because you're sleeping more often on the side that is slimmer, because constant pressure on one side can cause the fat cells to actually atrophy.
Yeah. Okay.
Okay. All right. Okay. Nice talking to you, Joanne. All right. See you.
I'm done with my treatments. Dr. Mark was really good. He was really fast and decisive with his injections. There was numbing cream placed all over my face to help with discomfort. So I'll see the full results in 1 week's time, but what I see now I really like.